Today's testimony features Mr. Gesh Kanyanta Chewe, a 74-year-old senior citizen and resident of Mpulungu. Mr. Gesh Kanyanta Chewe needed a coronary ballooning procedure, which cost an estimated 15,500 kwacha. Let's hear his story as it's narrated by his daughter, Kasonde.
When I learned about this scheme, I didn't know how helpful it was going to be. But I was in a situation where my father was needing medical attention, and this is when the scheme actually came through for me, and I began to learn about it and actually benefit from the scheme. So when I saw the scheme being new, I knew for sure that I was going to benefit from it. When my father had a problem, actually he is hypertensive and needed medical attention, he came to Chongwe where I work, and he was actually advised by his friend about the medical attention that he needed. But we had to go to UTH and find out the procedures, and we were told he needed to undergo a coronary procedure at Cath Lab. So because of the operations of UTH, as we may know, we were given a bill which was quite high. The bill for the procedure was about 15,500, which my brothers and sisters had to try and organize for that money. As we know, people have got different issues, and it's not easy to get such kind of an amount easily. So we had to try and organize for that money, and we didn't know how we were going to handle that. Of course, we started organizing some money, but it wasn't easy. So what happened is that one of the doctors at UTH, actually, Dr. Sunkutu, yes, advised us to say we could use the health insurance policy, which is NHIMA. And when I was told to do that, in my mind I was thinking I was going to register him on my beneficiaries, because we thought parents actually can be registered on the NHIMA policy. So when I went to UTH, I met a lady there who guided me, and she told me that actually my father could register on himself and have that NHIMA number. So I followed it through, and when I did that, I was only asked to give his NRC, and when I submitted that, I think it just took a day or two to have him registered and get the number. So what it was that they needed to actually approve that the procedure should go on, and that is how that was done. And NHIMA actually did the payment for that procedure, and my father managed to get the attention that he needed. So I benefited in that way. We saved the money. That part of the money actually was used for other expenses, because my father lives in Mpulungu, which is very far away from Lusaka, and to bring him here and take him back was very expensive. So instead of paying that amount, we were able to save some money from that. And also he needed medication, some of which we couldn't get from UTH. So we were able to at least facilitate the continuity of his medication as a result of the money that we were able to save, and other things that he needed as he was going back home.
What a happy ending. You have heard for yourselves how the National Health Insurance Scheme worked so well for Mr. Kanyanta Chewe and his family. You could also benefit from the National Health Insurance Scheme by registering today.
National Health Insurance, leaving no one behind.